If you have pain in your upper back between your spine and shoulder blades, the exercises in this video can help to eliminate it. My name is Dr. Jared, and if you have a deep, dull ache around the inside part of your shoulder blade, you might think it's muscular in nature. We have our rhomboids and our middle trapezius in that area. However, in a lot of instances, this is actually referred pain. That means it's coming from somewhere else. And in this case, it could be coming from compressed joints in your upper back or irritated nerves in your lower neck. This is especially true if you have a rounded shoulders, forward head posture. It just creates a lot of compression right at the base of your neck and in your upper back where those nerves exit. So in this video, I wanted to share with you 5 simple yet incredibly effective exercises at alleviating this irritation and helping your upper back to feel better. I hope you find this incredibly effective. Let's get started. Now, as your physical therapist, when treating this pain, we have to start with a discussion about activity modification. This is especially true if you spend a lot of time on a laptop computer or looking at your cell phone. Those are 2 of the biggest causes of this rounded head, forward shoulders posture. If you work on a laptop computer, I recommend that you get an external monitor. You'll be amazed at what that can do, just raising your gaze, raising your head a few inches higher. And if you spend a lot of time looking at your cell phone, can you bring it up from your stomach level up to chest level? You'll be amazed at how much better your upper back can feel simply by bringing an awareness to those 2 positions. Okay, let's jump in with this first exercise. The first thing that we want to do is a mobilization to your thoracic spine or to your upper back. In the physical therapy clinic, I prefer to do this on a foam roller. I know not everyone has access to a foam roller, so I wanted to show you the home version on a towel. Do not tell my wife I brought one of our new towels down here. What I did is simply folded it in half and then rolled it up. So roll up the towel, it's about 4 inches in diameter, and then you're going to lay that down on the floor. It has to be the floor. Don't do this on your bed. The bed is too soft and you won't get the effects of this mobilization. From there, what I'm going to do is lie down on top of that towel, and so that it's along the length of my entire spine. Bend your knees, that will make it more comfortable. Now for some of you, you might get some mobilization, some release, some cavitations from that. Totally fine, totally safe. You might actually feel better afterwards. But from here, what I like to do is just some gentle flexion and extension mobilizations. So with your hands, I want you to cup your head and then let your elbows relax and fall down towards the ground. Again, you might get 1 or 2 pops out of that position. From here, I just want you to lift your head up towards the ceiling, bring your elbows slightly towards the ceiling. Doesn't need to be like a full crunch, but from here, then we're just going to lie back down again. And then hold for about 3 to 5 seconds, and then up, and then come back down. And each time you do this, what I want you to focus on is just relaxing and letting gravity take your elbows closer down towards the floor. And so it looks just like that. And typically what I'll do is I'll repeat this about 10 times. And then on the last one, I'll have patients just lay on it for about a minute. Just let it really stretch, really just try to relax into that position. And again, about a minute worth on that. That's a great way to, again, just kind of loosen up that upper back, prepare it for some of the other exercises that we're going to be doing. After that, let's get into a thoracic rotation stretch. So to do this, go ahead and lie down on one side. From here, well, the first step is to bring both knees up as high as you can. The higher you bring your knees, the more it's going to lock out your lower back, the more rotation we're going to get through our upper back. I'm laying down on my left side. My left hand is going to grab the top of my knee. My higher hand is going to start by reaching forward as far as I can. You'll get a good stretch as you do that. So start reaching forward, and then we're going to open up. Let your gaze follow your hand. Let your eyes follow your hand all the way up and over, down as far as you can to the floor back behind you until you get a good, nice rotation through your upper back. We're gonna hold this position for about 3 to 5 seconds, and then we're going to repeat. So I'm gonna reset, I'm gonna come back to here, reach forward, and then I'm gonna open up. I'm gonna hold for 3 to 5 seconds, and then I'm going to repeat that 10 times. and then I would flip over and repeat that on the other side as well. It's not uncommon for some asymmetries to be there. You'll probably notice that one side is a lot looser than the other, but that's just an indication that that's a motion that we need to improve. Your upper back should be able to rotate. That's a great stretch to make that happen. Next, let's facilitate some flexion and extension through that upper back. This is going to be a cat-cow pose. For most people, the simplest way to learn this is just with a traditional cat-cow. I'm on my knees and I'm on my hands. I'm down here on all fours. I'm going to arch my back up towards the ceiling. I'm going to round my back. I'm going to tuck my pelvis under, and I'm going to tuck my chin into my chest. That's the angry cat portion. To get to the cow, we're just going to reverse everything. And so now my chest falls down towards the floor. My gaze comes up. I don't want you to look at the wall in front of you. Pick a spot about 3 to 5 feet in front of you on the floor, and that's as high as I need your head to come up. Again, it's this compression in our back or in our neck and upper back that we're trying to avoid. If we bring our head into this position, it just creates more of that compression. So try to keep your neck in a neutral position as you do this cat-cow pose, just like this. Now, if you can tolerate more than that, if you're ready for the next step, I like to show people this same pose, but now I just want you to sit down on your heels. So now I'm resting on my heels, hands are still here in front of me, and then I'm just going to repeat everything. But what you'll notice there is that my lower back is actually locked out. My lower back doesn't move as much, and that really focuses and isolates that motion into your upper spine and into that thoracic vertebrae, the area where we're trying to mobilize. I would repeat that about 10 to 15 times, hold it for about 3 to 5 seconds in each position. The last motion that we need to stretch is side to side, and there are actually 2 stretches that I like to do that. We'll start with an upper trap stretch. What I want you to do is take the side that is painful. For this demonstration, I'll say that that pain is on my right side. I'm gonna take my right hand and put it to the small of my back. That just serves to keep this shoulder blade down. Now I want you to tilt your head away from that painful side. So I'm going to take my left ear over towards my left shoulder until I get a good, comfortable stretch through this upper trap right here. For a lot of people, they can get a good, comfortable stretch just like that. If you need some additional pressure, take your hand and put it up to the opposite side of your head to just add a slight overpressure. Please try to keep stretching very comfortable. I would hold that for about 15 to 20 seconds, and then I would repeat that on the other side as well. I like to keep things even. Let's go for equal holds on both sides. And then to sneak that stretch a little lower into your upper back, I like a simple standing side bend stretch. You're going to stand, and then I'm going to raise my right arm up towards the ceiling and then over to that opposite wall as far as I can take it until I get just a really good stretch. You're gonna feel that a lot in your armpit and through your lats. You might even get that to sneak into your lower back. I would hold that there for about 5 seconds, and then let's go ahead and let's repeat it over this way. Hold it over this direction about 5 to maybe 10 seconds, and then we're going to repeat that each direction about 10 times. Is it okay if I over-deliver in this video and show you one bonus exercise? Because honestly, if you've been doing all the stretches and mobilizations until now, you're probably feeling pretty good. That's what stretching does. However, if we want that pain to stay away, we have to include some form of strengthening. So honestly, I wasn't gonna do this initially, but I just wanna show you one more quick way that we can strengthen those muscles between your shoulder blades and in your upper back so that pain eventually will stay away. And so we're going to do some form of row. I've got some elastic band right here. I'll also show you a dumbbell version of this depending on what you have available. Really simply, you're gonna anchor that in front of you, stand with really good posture, and then squeeze your shoulder blades together. Use your back muscles to pull your elbows back behind your body and then slowly return to that starting position. If you don't have bands available but you do have dumbbells, you're going to do a bent over row. Hold the dumbbells in your hands, hinge forward at your hips, and then again, we're gonna pull those shoulder blades together while pulling the elbows back behind your body and then slowly return to that starting position. And on those, I recommend 10 to 15 repetitions repeated 3 times. I hope these help your upper back to feel amazing, and thank you so much for watching.